The vagina is a delicate ecosystem, a finely tuned balance of tiny organisms working together to keep you healthy. But what happens when this balance is disrupted? Today on H-Medics, we're exploring how yeast infections develop, why they happen even in healthy bodies, and how you can help protect yourself. Inside the vagina live hundreds of microscopic organisms, bacteria, fungi, even tiny viruses. Among them, lactobacilli play a starring role. These helpful bacteria make lactic acid, keeping the vaginal environment slightly acidic, usually around a pH of 4. The Cleveland Clinic explains that this acidic setting is nature's way of defending against harmful bacteria and infections. Also present, in small harmless amounts, are yeasts from the Candida family. Most of the time, these fungi coexist peacefully with the good bacteria. Your immune system, along with these helpful bacteria, keeps their numbers under control. How yeast infections begin. Sometimes, though, this natural balance shifts. When Candida albicans, the most common yeast, senses an opportunity, it can change its shape and behavior. This happens when the vagina's pH rises, friendly bacteria are wiped out, or the immune system is weakened. Candida then transforms from harmless, round yeast cells to invasive thread-like forms known as hyphae. These hyphae break through the surface of the vaginal lining, damaging cells and triggering an immune response. That's when you start noticing classic yeast infection symptoms: itching, burning, swelling, redness, and sometimes a thicker, white, vaginal discharge. These changes happen because your immune system is trying to fight off the growing yeast, while the vagina sheds more cells to flush it away. Why do these imbalances happen? A lot of everyday factors can set the stage for a yeast overgrowth. Antibiotics, they don't just kill bad bacteria, they also harm good ones like lactobacilli, making it easier for Candida to thrive. Hormonal changes, menstruation, pregnancy, or even birth control pills can shift hormone levels and affect the vaginal microbiome. Weakened immunity. If you're sick or immunocompromised, your body may struggle to keep Candida in check. Tight, damp clothing traps warmth and moisture, perfect breeding ground for yeast. Harsh soaps or douching. These can strip away protective mucus and upset the fight. Sex. Semen is more alkaline than the vagina, and repeated exposure can sometimes disturb its acidity. That's why many doctors advise cleaning only with gentle water on the vulva and wiping from front to back to avoid introducing bacteria or more yeast from the rectal area. If this is making sense so far, please like this video to help others find it and subscribe to H-Medics for weekly reproductive health guidance. We're here to help you understand your body, treatments, and solutions. Most yeast infections are mild and resolve within 2 weeks with proper treatment. Over-the-counter, antifungal creams or oral medications can reliably bring Candida back under control. According to the NHS, these antifungals work by lowering yeast numbers, giving your body's defenses a chance to restore normal balance. For a small group, about 5 to 10% yeast infections can happen repeatedly, sometimes 4 or more times a year. For them, treatment may be longer or involve prescription therapies, and sometimes even genetic testing if a weakened immune response is suspected. Prevention tips and emerging research. Here are a few practical ways to help prevent yeast infections. Wear breathable cotton underwear. Change out of wet clothes quickly. Avoid scented soaps or douches. Manage blood sugar if you have diabetes. Maintain a balanced, nutrient-rich diet. Interestingly, researchers are also studying whether probiotic yeasts, the same kind used in bread or beer, might help keep Candida in check naturally. Early studies are promising, but still ongoing. Vaginal health is complex and still under-researched. For example, while erectile dysfunction affects fewer people than vaginal yeast infections, funding for ED research is 6 times higher. We need more science, more education, and less stigma around topics traditionally labeled women's health. At H-Medics, we'll keep sharing evidence-based information to empower you one truth at a time. Subscribe now for honest, science-backed reproductive health and wellness videos. Take charge of your health and never feel alone in your journey.